presenting very briefly today on the marking sheet for family medicine presentation skills. One of the formative assessment tools at our disposal is our ability to help improve the presentation skills of our residents and ourselves as we give feedback using the formative assessment tool provided in our curriculum. The form starts with an introductory part, which gives you the heading, marking sheet for family medicine presentation skills, and tells us what the score range is for different aspects of it. Now note that there will be specific rubrics for each section, but note that a score of 1 to 4 is a fail. It's assumed to be below standard for a family physician. A standard or pass is any score between 5 and 7, while a score above 7, that is specifically 8 to 10, indicates it's above the minimum standard and is exceptional, possible distinction. So please, we'll use this throughout for the sections with modifications as required. The first section you will run into for scoring is the section on presentation, structure, and so on. The weight of that section is 20. However, if this video you are going to watch or the presentation you watch is a short duration, you may not be able to do this fully. So for our purposes, for the practice video you will watch, it's a short mini presentation and you will not be able to do the full scoring, and so we advise you to give a score of 5, which is the minimum for acceptable to family medicine standard. But note that there are clear rubrics explaining what is fail when a presentation is disorganized and so on, compared to a well-organized presentation, which is excellent. We've also clearly stated in the rubric what a pass is, which is it finishes on time, is mostly organized and structured, maintains good organization throughout most of the presentation. The next section we will see, you will assess teaching aids used for readability, functionality, use of media, and effective use. Again, there are very clear rubrics for you to be able to assign marks between 1 to 10. And in this case, the weighting is over 20, so the marks are converted based on that weighting. The next section is an assessment of the nonverbal presentation skills, including posture, positioning, hand movement, whether they are nervous or not, the clothing, the mannerisms, and eye contact. Again, the weighting is over 20, and you can refer to the rubrics as presented for you to be able to score anything between 1 and 10, which is then converted to 20. The next section is the verbal, which has to do with the accent, the volume, the speed, the enthusiasm of speech, and pronunciation. The weight in this case is over 15. You still score between 1 to 10, and then it's converted based on the weighting. Again, clear rubrics are provided for each section, and what is clearly a fail and what is clearly a pass or excellent. You will also be scoring rapport with the audience. So apart from watching the presenter, you're also watching how they interact, their handling of questions, whether it's respectful and engaging. Again, the weighting is over 15. Clear rubrics for you to score poor presentations, excellent presentations, or acceptable presentations. You also score the content of the presentation. And in terms of content, you'll be looking at whether it's poorly defined aims, methodology, unclear results, and lack of insight and interpretation, or you will have very clear content of presentation. In this case, because it's about research and it's a journal critique, we've brought out the rubric to indicate what is poor, and what is excellent, and what is acceptable. And so at the end of all of these sections, you'll be able to have a total mark, which divided over 10 will give you the score over 10. Once you've done that, note that in the real document, there's also a space for documentation and feedback, the trainee's name and supervisor's name. Now, having gone through the tool, I will take this time to give you a practice assessment.
Thank you. Once again, good afternoon, consultants and resident doctors. Um, Thank you for your audience so far. So I will just continue from here, and I would want to engage us more because we have an objective for this, in that we want to ensure that when we do our own research for our dissertations and even afterwards, we are doing something that is actually accurate to the best of our ability. So for the results section, stroke check is asked, do they report the numbers of individuals at each stage of study? Once they were potentially eligible, they were examined for eligibility, confirmed eligible, and then included in the study, and then follow up. So this was not particularly done. Dr. Onibide mentioned earlier that even the eligibility criteria was not mentioned. So I was like trying to help this person. Within 5 minutes, I didn't see this person again. We went away with the question, just like maybe 20 of them. So Dr. Omar, if just like you said self-administer interviewer, what if you have 2 patients to recruit? Will you get this person that please wait? Or what can
I think it's good to go with the research assistant, especially if the sample size is big. Even if it's going to be a self-administered questionnaire, the research assistant can still be on the lookout for these other respondents, whether they are going or if they have problems, if they have issues with the questionnaires. It's just saying that you don't just hand over your questionnaires to respondents. You have to take them through the maybe kind of introduce your topic, your questionnaire, the aim. So once they know the importance of the questionnaire, they might be willing to give you correct and detailed information.
Thank you very much, ma'am. So that was one of the flaws that I made during my pilot study, that there was no research assistant. And in that sense too, what would have also come up is that if you are doing self-administered interview administered, this person can interpret your question somehow and answer the way he or she understands. But if you are doing interview examiner, you can actually try and tell the person this is the way you are asking the question. You ask it the same way. So if I do interview administer for her, I will ask the same way I ask her, it's the same way I will ask him. Rather than he interpreting it himself in another way, we can actually be a confounder in studies too. So those are the things that they could have done to mitigate this. Then do they indicate number of participants with missing data for each of the variable of interest? Like Dr. Onibide said, there were no missing data. Of the 80 that they actually got from the questionnaire, they all responded to the question. So did they report numbers of outcome events or summary measures? Yes, they did. The outcome variable that they had in this study was the cooling practices of the health workers at home and at work. So those were the primary outcome. The other variables were their independent variables. And they actually, if you remember, if you check our article, they showed that explicitly in figure 1 and 2 of the results session. Then, do they give unadjusted estimates, and if applicable, confounder adjusted estimates and their precision, given the confidence interval and the level of significance? They stated that in the Okay, why the response is not showing is because I intend to ask it as a question too. And I think I would choose, I want to call because, okay, maybe anybody that wants to answer. So that I know that I should be a senior resident. Sometimes junior resident might not really. Okay, so in that if you have actually followed the article, we couldn't review the journal word now, but if you had read this article, so why do you think they gave unadjusted estimates? Did they do confounded adjusted estimates? Anybody? I got confused. Like, how would you mention that you did a bivariate analysis and I can't see a table that is comparing two variables? If you look at that table very well, they only add their variable that was asking question. They add the frequency of the respondents, and then they now did a chi-square. They now did a chi-square and p-value. And from the knowledge I had, like before you do a chi-square and p-value, you must have two variables that you are actually comparing. So, but it is that for chi-square we can actually have two types of it. We can have the chi-square test of independence, and we can have the chi-square goodness of fit test. The goodness of fit test is the one that actually analyzes, that does univariate analysis. That's one variable analysis. Why that of test of independence does bivariate analysis. And in this case, that was what they were doing, the goodness of fit test, even though they didn't explicitly mention.
Okay, so thank you for watching the video. It's time for you to complete your assessment.